Hey, this is Dr. Ben Weitz, host of the Rational Wellness Podcast. I talk to the leading health and nutrition experts and researchers in the field to bring you the latest in cutting-edge health information. Subscribe to the Rational Wellness Podcast for weekly updates. And to learn more, check out my website, drweitz.com. Thanks for joining me, and let's jump into the podcast. Hello, Rational Wellness Podcasters. I'm very excited today to speak to Dr. Isaac Eliaz about his new book, The Survival Paradox, Reversing the Hidden Causes of Aging and Chronic Disease. When we are facing threats to our survival, such as trauma or disease, this triggers our stress response, which is also our survival response. This does allow us to run from a lion, but it doesn't help us to marshal our immune response to fight off cancer or heal from many of the other inflammatory chronic diseases that are the major killers for today. And this stress response triggers inflammation and the activity of galectin-3, which is an inflammatory protein that can harm us if it is not controlled. Dr. Eliaz refers to galectin-3 as our survival protein. And research shows that it is involved in quite a number of chronic diseases, including Alzheimer's disease, arthritis, heart disease, diabetes, chronic kidney disease, liver fibrosis, and metastatic cancer. Fortunately, there is a way to get rid of and control galectin-3, and that's this incredible nutritional compound that Dr. Eliaz developed, known as modified citrus pectin, and known as Pectisol C. Dr. Isaac Eliaz is an MD and acupuncturist, and he's been a pioneer in the field of integrative medicine since the early 80s. He trained in Tibetan Buddhism for decades. He's a respected researcher, formulator, author, and clinician. He's published many scientific papers, especially related to galectin-3 and modified citrus pectin. He has a busy private practice in Santa Rosa, California, the Amitabha Medical Clinic, with a focus on cancer, Lyme disease, and other chronic diseases. And he's advanced the use of plasma apheresis, as well as other groundbreaking treatments for cancer and other inflammatory conditions. And most importantly, Dr. Eliaz is a wonderful human being who cares deeply about his family, his patients, and the planet. And he's been contributing to promoting the interests of all of them. Isaac, thank you so much for joining me again today.
Hi, Ben. It's so good to talk to you again. I love our talks, and thank you for the warm introduction. I really appreciate it.
Absolutely. It's always a pleasure to speak to you. Congratulations on getting your book, The Survival Paradox, published.
Thank you. Thank you. I'm very excited about it. It actually launched today, so I'm so glad to talk to you on launch day.
Now, I think this book is a long time in the coming, right?
Yes. This book specifically, I worked on it for 3 years with the help of a lot of people. Right. But it expresses decades of studies, of contemplation, of clinical work as a clinician, as a doctor, as a Chinese medical doctor, and as a healer. And together with decades of training in meditation, and it kind of all came together in the realization of the survival paradox. It's really it's something, it's hard to wrap our head around it. It's actually what helps us survive. It's actually what shortens our life. But that's really this is really what paradox is, right?
Right. So tell us a little more about what the survival paradox is.
There are different angles to look at it. Usually, I actually want to take an angle that you like, because you like biochemistry. And we recognize now that inflammation is a driving force for every chronic disease, right?
Yes.
So in integrative medicine, we know it for quite some time. I've been referring to it in an intense way for about 30 years, and people in the last 20 years. And now I think with the COVID, uncontrolled inflammation, cytokine storm has come to the forefront. But is inflammation really the cause? It's really not the cause. Inflammation is a result. So we are stuck with treating the result without looking at what caused the inflammation. Well, what causes inflammation is our survival drive. And so that's the first major contribution of the book is I take the audience, the biohackers, longevity people, who are the mind-body people, the people with chronic diseases, the doctors, the healers, and I now say, okay, we know about inflammation, but this is just a result. That's really an expression of what? Of our survival drive. So how can it happen? We are innately built to survive, right? It's built within us. It's our ego clinging, it's our identification, and it has been like this forever. Every living being wants to survive. And if it's true, it has to be automated and we can control it. And that's the case. We have an automatic survival response through, and from your work with your patient, it so well, through the autonomic nervous system. The sympathetic response is a survival response. It happens in milliseconds, right? And we get a sympathetic flow. And then when we get out of survival mode, the body relaxes by being balanced with the parasympathetic. So survival response sympathetically has either a fight response, which changes in breathing, in heart rate, in circulation to the digestive system, bladder, sweat, etc. We don't need to go into the details. And then we either fight or we run away, right? When we run away, we move into a survival metabolism, right? We move into glycolysis. That's why short-term sprinting, it doesn't use aerobic metabolism, it uses glycolysis. And then, or we're going to fear, we hide, we shield ourselves. So that's, and ideally we respond and then we can relax. So in ancient time, we're in danger. And then we got out of danger, we relaxed in our hut, around the fire, the parasympathetic system nourished us. These are not the days. We are now into a sympathetic flow all the time because we get text messages and radiation and cosmic radiation and computers, and people want us to respond in seconds. And we are in a total sympathetic flow. And this by itself degrades the immune system, degrades our whole being. It's profound. But then it goes to, but we still have a chance to balance relatively quickly. If we go on a weekend and relax, we feel a difference. And we can talk a lot about it, why it's so hard to come back from a vacation, why we get exhausted when we come from vacation, right? Everybody experiences, because we change our receptor ratios on the surface between parasympathetic and sympathetic. We're not ready to the sympathetic heat, but that's a side topic. If you want to, I'll revisit it. But then we got our biochemical survival response. And this is the driver of the biochemical survival response. And there are a group of proteins called alarmins. The driver is galectin-3. And why? Because galectin-3 is like the bus, like the train, like the skeleton. It gets expressed within minutes from the tissue that is under stress. And it has the ability to bind to different carbohydrates. So it can bind to oligosaccharides, to glycoprotein, protein with sugars, to glycolipids, oxidized lipids that carry also heavy metals and toxins, and to different growth factors. And it carries them to wherever the body wants. So we got this basic structure that is so versatile that can affect every possible diseases. Indeed, galectin-3 is practically involved with every chronic disease. So,
but you're also saying that there's some benefits to galectin-3 in the short term.
Absolutely.
Right? Just like there is with inflammation, short-term inflammation is good because it promotes healing. It's the long-term chronic inflammation that
absolutely. So the long-term sometime is 10 minutes. It's already long-term, the response. So galectin-3, indeed, so it starts the injury repair, but it doesn't turn off. Now, galectin-3 is really the upstream molecule, and all the cytokines follow down. So, a lot of treatment that try to neutralize interleukin-6, remove cytokines, they're not working. It's too late. So if we look at changes in the level, if somebody is at the top of the arrow, you don't need, right here, Ben, there is a very small change, right? Look, from here to here, it's a tiny space. But look what happened when we go down, right? Now we got this amount of space. So galectin-3 will go up by 50%. Sometimes will double. C-reactive protein, interleukin-6, TNF-alpha will go up 1,000 times. because these are downstream. This is like a whole waterfall, whole cascade. So by addressing galectin-3, we cut down the whole inflammatory process. So that's the physical biochemical aspect of the survival paradox. It's only one aspect. The survival paradox is our whole experience of life. It's how we live our life. It's how we treat our cells. It's how we treat our microbiome. It's how we treat our family, our community. It's how we treat people who don't agree with us. It's all the survival paradox. It doesn't work when we fight. It never worked and never will work. It's a short-term solution. So, understanding this, we start to get a deeper glance of the survival paradox. So in the book, I take the reader through the whole journey, what is the survival paradox? Who is the architect of the survival paradox? Galectin-3, the effects of a survival response, how it's created, and how it affects inflammation and fibrosis, how to block it with modified citrus pectin. And then I talk about the pivotal chapter in part 1 is the heart of survival. How the survival of the heart is our key to transformation. Because the heart survival energy, the heart survival role is to transform the survival role. It's built within us. That's the beauty of it. Otherwise, what's the point of writing a book if there are no solutions, And then I go, so people, it's like a wow, I've had people, practitioners for decades, or people who are medical writers who have had chronic disease for decades and tell me, Isaac, I didn't really realize it until the book was done. And they tell me, no, Isaac, I've been in this field for 30 years. I've been treating my problems for 30 years. You turned my whole thinking upside down. I was totally off. I didn't get where the problem is. So then I take this and I go through every serious disease. Of course, I do a lot of cancer work. So the biggest chapter is cancer. And then I go about heart disease and kidney because they are related in Chinese medicine, water and fire. And I want, as a side comment for anybody studying or practicing Chinese medicine, this book has jewels of Chinese medicine from decades of esoteric studies of Chinese medicine. And I kind of sprinkle them through the book. And then I go liver and lungs. So I cover the basic organ system. I go through the metabolic system, which you are so interested in. I go through the neuroinflammatory system. I go through the immune system, and I go through the microbiome. And then I start talking about solution. So I present detoxification in a much bigger picture, much broader understanding than just eat this or do that. And then I go to maybe my favorite chapter, or I have 3 favorite chapters, is healing our scars of survival. How we heal our scars, our physical, mental, emotional, psychological, psychospiritual, our scars and the scars of our ancestors, genetic and, more important, epigenetic. And I really go through what a cell goes through, because a cell is a living creature. It has boundaries. It decides what comes in and what goes out. And it can make some decisions, sometimes good decisions, like it wants to play with the environment and be in harmony. And sometimes it goes into survival paradox mode and wants to survive. It doesn't care about the environment. It creates a microenvironment. It doesn't communicate with the system. It becomes more aggressive. How do we call it? We call it cancer. So I talk about how to heal the scars of survival, and I give my own story. Being a Holocaust, family from a Holocaust survivor, how my grandmother responded, how my grandfather responded, who I'm named after, my mother, and then how I, by healing my Holocaust trauma, which wasn't mine, it was from my grandfather, which I didn't know, but I'm named after, took away all my symptoms after 60 years. And how my mother healed without knowing that I healed my own. It's a beautiful story. And then I go to the real depths of transforming the survival paradox, at least from an understanding. It takes years of practice. Is the survival response really the cause? Not really. What causes the survival response? What causes survival response is the survival response. We cannot accept that everything changes, that everything that is born, everything that expresses itself is going to fall away. A very basic Buddhist principle. We don't accept impermanence. We solidify our experiences. That's the essence of survival, right? We don't want things to change. And how do we change it? So through the book, the emphasis from modified citrus pectin, from lifestyle, from specific advice in the light of survival. So whatever, for the practitioners, you'll do the same stuff you do, but you'll have a different flavor, you'll have a different understanding, different eyes. And then I go through the major transformative organ, and we are built to transform our survival paradox, is the heart. And through the book, I give dozens of stories of my heroes, of my patients, how they healed. Sometimes they healed and the disease went away, and sometimes they healed and they died, but they still healed, you know? And these are very inspiring stories. And it was hard to choose who to put in, and there wasn't space for everybody, but I got the vast majority of my heroes in. And so it's inspiring. It's really, the book is alive, you know, and I really think it's almost like a manual, you know, that you can read. It's very, it's in one level, it's an easy read. It's very, because my precious daughter, Lee, really upgraded the writing and the editing. She's a brilliant writer. And it comes from my heart. You can feel it. But it really has a lot of valuable information. And then at the end, I provide close to 80 pages of valuable appendixes. So practical, detox protocol, diet protocols, what supplements for which conditions, what dosages. So I give the practicality, but I don't exhaust the reader with the details. I want to teach the reader how to change things instead of just giving them 5 steps for this, 8 steps for this. So in this sense, yeah, I think the book can really help many people. That's the feedback I'm getting from. Sometimes it's almost shocking to me.
I've really been enjoying this discussion, but I'd like to take a minute to tell you about a new product that I'm very excited about. I'd like to tell you about a new wearable called the Apollo. And this is a device that can be worn on the wrist or the ankle, and it uses vibrations to stimulate your parasympathetic nervous system. And this device has amazing benefits in terms of getting you out of that stressed out sympathetic nervous system and stimulating the parasympathetic nervous system. It has a number of different functions, especially helping you to relax, to focus, to concentrate, to get into a deeper meditative state, even to help you sleep. And there's even a mode to help you wake up. And this all occurs through the scientific use of subtle vibrations. For those of you who might be interested in getting the Apollo for yourself to help you reset your nervous system, go to apolloneuro.com and use the affiliate code Weitz10. That's my last name, WEITZ10. And now back to the discussion. You know, every time I talk to you about galectin-3 and modified citrus pectin, and this whole story is so amazing, and I always come away from the conversation going, this is amazing. This is so important. And I'm just shocked that nobody else is talking about it.
Well, you know, it's a little bit my life journey. I'm kind of always ahead of the curve. It's a very lonely journey. I'm used to it. I like it, you know, I'm used to it. But the only person often you can talk to is yourself. You know, and
I talk to myself all the time.
You know, like I talk to doctors, I can understand their language, and I understand they can't really understand how I think, most of them. If I find somebody who does, my God, I'm rejoicing. My family can. And both my precious wife, Gilly, and my daughters, you know, one who is a spiritual teacher, Lee, and one who is finishing medical school in UCSF. They have this kind of understanding. But you know, so we talked about chronic disease, but what we have realized in the last few years is that the galectin-3 is a driver of acute disease, myocardial infarction, but most important, sepsis.
So wait a minute. The galectin-3 is a driver of myocardial infarction?
It will make myocardial infarction worse.
Okay.
And yes, but for example, if somebody goes and so when we look at acute damage to the body, the most important organ that affects our whole health, despite the heart when it stops working, it's our longevity organ in Chinese medicine, is the kidneys. So very often in sepsis, in crises, in circulatory problems, we get what is called acute kidney injury, AKI. Very common, completely overlooked. And as a dear friend of mine, really a giant in nephrology, Professor Glenn Cherto, he's the head of Stanford Nephrology, says, Isaac, people die because of AKI, not with AKI. And he's been trying to say it for decades, and this has been my observation, not being a nephrologist, and galectin-3 drives it. So I've published 2 really important papers with great authors, with the person who is the most well-known critical care doctor in the world, ranked number 1, with John Kellum and other very well-known doctors. And we showed that when a patient comes to the intensive care unit with sepsis, with no pre-existing condition, they got a blood infection, the level of galectin-3 at the time of admission will determine who will get acute kidney injury and who will die during the ICU. It's insane. No other markers is better. And a patient that gets a coronary artery bypass, people don't know, one of the reasons and the fears of doing coronary artery bypass is acute kidney injury. 10 to 30%, 5 to 10% get serious kidney damage, and 2 to 5% die. And none of them should die, because most of the surgeries are elective surgeries. You find there's a problem and you do the surgery. The level of galectin-3 before admission to the surgery will determine who will get AKI. In the study we published, the level of galectin-3 when you leave the surgery and go to the intensive care unit is the best marker in who will get AKI, acute kidney. And in the most acceptable animal model, both for sepsis and for circulatory injury, acute kidney injury, when we gave Pectasol for a week before the procedures, the animals that got it had a dramatic decrease in AKI and mortality. And another thing that I am developing, galectin-3 apheresis, when we took animals with the septic model and we filtered their blood with a specific antibody that removes galectin-3 from rats, 8 out of 9 of animals where the column was empty, sham column, what we call fake column, 8 out of 9 died, compared to only 1 out of 10 in the one who got one single apheresis. Why? Because when you remove galectin-3 very early on, an hour after the injury, interleukin-6 goes down, and kidney damage goes down, and survival goes up. So this shows us how the survival response, uncontrolled, and it's all happened in an hour. Long term is not 2 weeks.
Right.
It's, the body needs a message and relax. Babies know how to do it. When we get a cut when we are babies, it heals right away. But our bodies, we have more injuries and we have more traumas, and our metabolism changes. We lose our resilience, our flexibility. And this loss of flexibility affects our injury repair, but not only physical, emotional, psychological. We see it in medicine, right? I will study a certain area in medicine where I have a belief system. And then 3 years later, I will see something that is different than this. I let go of the other thing. That's okay. Doctors usually cannot handle it. They feel threatened. Why do they feel threatened? Survival response. So the survival paradox, Ben, is deep. It's really who we are. And it can really transform our life. It can connect us with our heart, because the heart is the organ that is built to transform the survival paradox.
It's interesting. I was just talking to another doctor about a patient who has acute rhabdomyolysis, and his creatine kinase went high, and doctors are saying that if it doesn't come down right away, he could have acute kidney injury.
Right.
Would galectin-3 also be a factor in this condition?
Usually, yes, because of the acute. But the problem here is that the kidneys are bombarded with rhabdomyolysis that just blocks the nephrons. It's like a filter that is full of stuff and can't filter anymore. But yes, you have to reduce the inflammatory response, and definitely. But it's a little bit more of like an unusual reason. The most common reason for AKI is sepsis and perfusion injury. Blood is not getting to the place.
Yeah, this was just from somebody over-exercising.
Exactly. Very important. So in the book, I talk about over-exercising, that it's not a good thing. And it's very interesting. And then I kind of made my statement malware, but that's exactly it. When we exercise too much, we put strain on our system and it changes the metabolism. Wow. That's quite something from over-exercising. This person must have really over-exercised. My gosh.
So is galectin-3, is it contained in our diet at all?
No. Galectin-3 is a protein produced by the body.
Okay.
And it's produced by macrophage. It produces at the tissue level. But we have to remember, we are not the only ones who want to survive. Cancer wants to survive, so it will use galectin-3 to shut down the immune system. So, for example, cancer patients getting immunotherapy, if their galectin-3 level is high, they will not respond to immunotherapy. It's well known. This very expensive treatment. But infections also want to survive. Our microbiome wants to survive. So when we treat our microbiome well with harmony, then microbiome serves us, right? It even activates chemotherapy in cancer. It activates immunotherapy. When we attack our microbiome with inappropriate diet, with stress, with antibiotic, the microbiome will respond with a survival response. How will it respond? By utilizing galectin-3 to dock into the lining of the gut and create a microfilm, a biofilm. Galectin-3 is a skeleton of the biofilm. So here is an example of a relationship between us and the microbiome. So now we are in this insane pandemic. Well, COVID wants to survive. The spiking protein of the COVID is practically identical to galectin-3, identical, okay? So galectin-3 blockers will play a huge role in preventing severe COVID.
Right.
And because that's the same survival drive. And there are a lot of galectin-3 receptors in the lungs, highest amounts in the body. So, for example, a large study from Mexico City from a very good, the last author is a very good researcher and physician who I published with. I kind of turned it on into galectin-3 when she was in Harvard, and she helped with my apheresis study, brilliant woman. And they did a study in the emergency room, checking COVID patients coming to the emergency room. The level of galectin-3 in the ER, regardless of the amount of involvement of the lung at the time of admission, determine the severity of the disease and who will die.
Really? What was the cutoff for severe COVID?
For them, it was 30, but I wouldn't jump on it. It's a big issue because there are so many different kits and methods. And that's a very important message for the clinician. Now we're moving more into galectin-3 and away from the survival paradox. Don't tailor your treatment of using modified citrospectin to the level of galectin-3. Galectin-3 levels are very complicated. There's a diagram, if I can find it quickly while we talk. So if you can look at here, you can see that galectin-3 can be in pentamers,
right? 5,
and can be in monomers.
Okay.
The antibody that detects galectin-3 in the diagnostic counts this as 1 because it binds here. It counts this as 1. So people who have more monomers will have higher level of galectin-3. And it's a genetic MMP9 effect. There's a total balance between the two. So you really give modified citrospectin based on the health of the person. And that's why who needs to address galectin-3? Anyone that is breathing. I'm not exaggerating, okay, Ben? Anybody above the age of 30 has to start taking modified citrus pectin daily. It's the most important supplement, not because I developed it. And again, all the research was done on pectasol. We have now 72 papers. It's because galectin-3 drives every chronic disease. Some of them you don't see the effect. So you can use your supplements, and you can use your herbs, and you can use your drugs, and you can do chiropractic adjustments, you can do acupuncture. MCP will help the results because it allows the medicine, whatever you're doing, to get into the problematic tissue. It reduces inflammation, it stops the fibrotic process, it regulates the immune response, and it removes heavy metals and toxins and mold toxins. So it's really this gift from nature. And when we started the journey, I collaborate with Dr. Avram Raz, which is really the person who discovered the galectin-3 and the use of modified citrus pectin in the early 90s. And then I discovered a lot of the uses of modified citrus pectin. And we published one very important paper recently together, and we worked together. And, you know, we always say to each other, it's amazing. We never thought, 30 years ago, 25, 26, 27 years ago for me, that galectin-3 will be so big. It was really all about cancer metastasis. Again, survival of the cancer. Galectin-3 helped it metastasize and attack. And then it affected the primary tumor. But I started observing in the late 90s an anti-inflammatory effect. Joints pain, memory, blood pressure getting better. And so I made this very important discovery on inflammation and fibrosis. People thought I'm crazy. 10 years later, it became known, and now it's the focus of so many universities and a lot of borrowed science after my work, but that's fine. It's nice when other people follow what you discover. But so it's a fundamental supplement in every program, and I've been very bad in putting it out. The ratio between research and how known it is not good. There is so much research, and people are not aware of pectasol. It's a must.
Right.
And for people who are sick, they really need to take 15 grams a day. We see it. We see it with joint pain, with digestion, with Lyme disease, mycotoxins, protection, especially chronic kidney disease. People who have deteriorating kidney disease, unless they are really close to the total failure, where they have a problem with what they are taking, they should take a lower dose if their EGFR is under 15. They got to use modified citrus pectin. It will most probably slow the process, stop it, and some people, it completely reverses. I have people who were deteriorating quickly, were already stage 3 chronic kidney disease. They just added pectasol and they completely reversed, which is unheard of. Which is unheard of.
Purpose, it would be what, 15 grams a day?
Until they get to the late stage, full dose. Because guess what? Also, it protects your heart. It protects your brain. It protects the circulation. The kidneys are not an isolated event. So our focus with our apheresis, for example, is on sepsis and acute kidney injury. We really believe that if we take out galectin-3, we know it from the studies. We showed it now in the animal studies. If we take galectin-3 from a septic patient right away, they will not die. You know how many hundreds and hundreds of thousands of people a year die from this United States? Millions, 11 million all over the year. A year die from sepsis.
Right. And so your apheresis is when you take the blood out, filter it out, like in this case, filter out the galectin-3 and then put it back in.
Yeah, and this is in development. We are 3-4 years away if we raise enough money. But we are on a favorable path. We got committed people working with us, and so it's very exciting. And meanwhile, in the clinic, I use a different device, an LDL apheresis. It just pulls out oxidized lipids and inflammatory compounds, kind of like the downstream effects. But we are still seeing very, very significant benefits. But in my opinion, and again, I'm a cancer guy, but now I've accumulated enough patients that practically almost everyone with chronic kidney disease is benefiting. It's insane. People who don't know this, you ask a regular nephrologist, can you improve chronic kidney? It's possible to improve chronic kidney disease. They'll tell you, listen, did you drink a bottle of vodka last night? It's impossible. What are you talking about?
I'd like to interrupt this fascinating discussion we're having for another few minutes to tell you about another really exciting product that has changed my life and the life of my family, especially as it pertains to getting good quality sleep. It's something called the Chili Pad, CHILIPAD. It can be found at the website chilisleep.com, which is CHILISLEEP.com. And so this product involves a water-cooled mattress pad that goes underneath your sheets and helps you maintain a constant temperature at night. If you've ever gotten woken up because the temperature has changed, typically gets warmer, this product will maintain your body at a very even temperature, and it tends to promote uninterrupted quality deep and REM sleep, which is super important for healing and for overall health. And if you go to chilisleep.com and you use the affiliate code Weitz20, that's my last name, WEITZ 20, you'll get 20% off a Chili Pad. So check it out, and let's get back to this discussion. Is galectin-3 affected by non-steroidal anti-inflammatories, corticosteroids, any of the other anti-inflammatories, curcumin? Do any of these things affect galectin-3?
They won't block galectin-3, but when inflammation gets better, over time, galectin-3 will go down. Okay. So we have to understand, I published a very interesting case report on a cancer patient who had an autoimmune disease. So as I was helping her autoimmune disease and the cancer was still growing in preparation for chemo, her galectin-3 actually came down while her CA-125 went up. But then she had this insane response to chemotherapy because she wasn't inflamed anymore. So yes, so it's a result, again, inflammation, it's a result of reduction in inflammation. So inflammation is very tricky because you can have overinflammation, very common, but you can have underinflammation. So one of the groups of people where the inflammatory response is inappropriate and they go more into a fibrotic response is Lyme patients. So you can see in Lyme patients that C-reactive protein will be very low, almost universally. TGF-beta1, a fibrotic marker stimulated by galectin-3, will be very high. And galectin-3 will be very low because they lost their repair capacity. You give them modified citrospectin or you do apheresis, you regulate it. CRP goes up to normal, so from undetectable it will come to 0.2. TGF-beta will come from 20,000 to 6,000. And galectin-3 will go up from 3 or 4, which is under, to 6, 7. So it's very important for practitioners and holistic doctors know this. When you look at blood tests, forget the norms because standards are standard. A standard is very large. A standard here is very different than standard here. So sometimes blood tests are illusory, just like the cause of diseases. You can see a cancer patient with no inflammation. You do apheresis, nothing comes out. How exciting. No, I know already, I've experienced. I look at every filter, I can see the patient. It's the insight. The disease is so anchored that the body is not releasing it, or it's buried very deep and the body cannot reach it. You treat the patient, suddenly the markers change and they come into the middle range. Now they're expressing, suddenly they start pouring all their toxins into the bag in apheresis. And so MCP, Pectasol, and addressing the survivor paradox addresses it. We have to peel off this shell, this protection, and then the body can make its changes. And that's the depths of the survivor paradox. And again, modified citrospectin is the one very important essential part but it's only part of the picture. The real transformation of the survival paradox is connecting with our heart, which I would like to explain, unless you have another question.
Sure. Go ahead and explain.
So if we look at our body, and really I'm like at awe every time I think about it. So we have about, I like to round it to 50 trillion cells. Some people say 37.5. I have no idea where they got to this number. 50 trillion. Okay, so not million. Million times 1,000 is billion. And billion times 1,000 is trillion. 50 trillion cells. Each cell, Ben, can have between hundreds of thousands to 1 million reactions a second. A second, okay? So we got 50 trillion cells going through 1 million reactions. Okay, so it's 10 to the 13 times 10 to the 6. So it's 10 to the 19, almost Avogadro number, almost like, it's like insane, almost infinite, no? Reactions every second, okay? And all of this in our body, plus 100 trillion organisms in our microbiome, and we all function and we are alive. If you don't call this a miracle, I don't know what is a miracle, okay? It's a miracle. It's a miracle of life. We have to really appreciate it. How can it happen? Because of mutual support. Because each cell understands it's a part of a bigger system. When this falls away, when we get trapped in the survival paradox, that's when cancer starts, autoimmune starts, stress and suffering starts, fight starts, and it affects everybody. So the cell knows that it's a part of a system, but it still wants to survive by itself. So how does the cell does it? It chooses what to take in and what to take out. It has a semi-permeable membrane, right? It has receptors. Now, of course, the receptors can be affected by the environment and the cell doesn't have so much choices, right? If all the insulin receptors are blocked, there's no normal glucose metabolism, Ampk get blocked, mTOR1 goes out, you go into glycolysis, you either get metabolic disease or you get aerobic glycolysis, Warburg effect in cancer. So the cell is part of the environment. The cell has to take care of the environment, has to take care of itself. But the cell excretes what it doesn't want into the environment. And then same level in a tissue level, and I love to give the kidney, I always like to give the kidney example. If the kidney feels that it doesn't get enough blood, doesn't get enough oxygen, it goes into a survival crisis. What happens when we can't breathe? We go into survival crisis, right? So what does the kidney does? It says, get me more blood. So this happens when you have arteriosclerosis in the kidneys, or you have kidney artery, renal artery, stenosis. What does the kidney do? It excretes vasopressors to increase the blood pressure. The heart now pumps blood at higher pressure. What does it do? It increases the damage to the kidneys. The kidneys get less blood. Eventually, the kidney will go into failure, the most common cause of kidney failure. And that's what happened during CABG, during surgery, when you shut down the circulation. And eventually the body will die. So every organ is for itself, except one organ in the body, our heart. Our heart survival, it takes dirty blood from all over the body. Whatever other cells don't want, the heart accepts with an open heart. It doesn't say I'm going to take blood only from the liver, but not from the lungs, or not from the brain, or not from your right foot. It takes everything. Okay? And remember, from a timing point of view, anything getting to the heart belongs to stuff from the past that was released from the cells and let go. So all the stuff we are letting go from the past, so it can be a molecule that the cell got an hour earlier and it doesn't want. But it can also be a carbon molecule that the cell got 30 years ago while the body was going through trauma. And now the cell released it, like during detox. So the heart takes all of it. And instead of fighting, saying, no, I'm not going to give it, like a cell can shut down, arterioles can contract and expand, the heart simply connects to the universe through the lungs, through the breathing. So the lungs really, the role is to serve the heart. It's the only role. And we let go of our volatile toxins of carbon dioxide, our drama, is nothing for the environment. As long as we take care of the environment, if we don't take care of the environment, we're not going to get clean air. If you think about it philosophically, anybody listening to this, the molecule of air in your mouth or in your nose, the moment it comes in, it's connected to you and it's connected to the whole universe. The whole universe, right? It's one big space.
Right.
That's the connection we have. So now we take air that comes into the lungs, the lung contracts and it sends blood everywhere without discrimination. The aorta is a rigid artery. It can't contract and expand. It sends blood up, down, left, right. It's downstream that we start playing monkey business, who gets blood, who doesn't get blood. And who does the heart nourishes first? It nourishes itself through the coronary artery. So the beauty of this for me, and wow, I mean, I've never heard this description until it came to my mind. I was meditating. The heart nourishes itself in order to nourish other organs, so it can do its work, and it nourishes itself as part of nourishing everybody. So this is when our heart is open and we give love, compassion, nourishment to others, we can also give love, compassion, nourishment to ourselves. That's the healing of the survival paradox. But if we just want to love ourselves and focus on ourselves, it's called narcissism, it's very different. And the heart is the only organ who nourishes itself after it finished its work. Think about it, Ben. It finished its work. It got the blood. It connected with the universe. It got oxygenated. It sends the blood. Only when it's out of the heart, totally selflessly, it takes care of itself. So this means that we are built in to do this. And that's why certain meditation techniques, they take in suffering and transform into love and compassion. Tonglen is a classical meditation. It's so easy to learn and so profound because we are built to do it. We don't have to experience. It's who we are. That's what the heart does. So we do it physiologically anyway. We just connect with it on a mental, meditative level, emotional level, psychological level, and suddenly we don't have the same reactivity. And when we do this, things change. That's why there's so many studying on the healing power of love and compassion. But the heart also has the greatest electromagnetic field in the body, 100 times greater than the brain. So the electromagnetic field of the heart is a few yards, which means that we are heart to heart connected. People around us, we are connected heart to heart. That's why we can feel people around us. But more than this, the heart electromagnetic field is touching every cell in the body in every single second. And this is why I call this, and it's the topic of my next book, open heart medicine. When we open our heart, we connect with our infinite healing power. And because the essence of survival, of transforming the survival paradox, is recognizing the impermanent, for people who are more meditators, the illusory quality of our experience. If everything is changing all the time, then anything and everything is possible. And that's why one of my favorite saying that I know I probably told you before is, not everybody is going to be a miracle, but everybody can be a miracle. And that's tapping into our infinite healing potential. That's the transforming and freeing of the survival paradox. And this is really based on a certain vision I had many, many years ago when I was in the mountains for months on my own, that gave it to me in a very esoteric, way related to some Tibetan studies. But then I realized, my God, forget about this. This is practical. That's who we are. We have this in each of us because it's all in our heart. And it's a life journey. I mean, I'm just a beginner myself, but it's a journey. And the nice thing is, as His Holiness Dalai Lama says, there is no limit to love and compassion. It always can grow and open and open. And that's a different level of healing that is beyond just physical healing. That's beyond a physical disease. But when we put it together with blocking galectin-3, with changing our lifestyle, with proper exercise, then we get amazing physical benefits, of course.
And of course, with respect to the heart, galectin-3 is a major factor in heart failure, which ends up resulting in fibrosis and also plays a role in aortic stenosis.
Huge and interesting. Yeah, and you are really well versed in the galectin-3 literature. Galectin-3 plays a specific role in what we call ejection fraction preserved. In the worst heart failure, which is the one when the heart doesn't become too big, the heart becomes stiff, fibrotic. Why? Because galectin-3 drives fibrosis. But if you think about a fibrotic heart that doesn't contract, there's a beautiful song in Hebrew that was written about the Western Wall, the Wailing Wall of the temple, about the big stone. They said there are stones which are like a heart, and there are heart of people which are like stone. So when we have a stony heart that doesn't want to give, we get fibrotic. We get aortic stenosis. And I've seen patients like this, where they are self-focused, they can't give. Sometimes they're not aware that they can't give. They will get fibrotic heart. And when you start changing it, the heart will get better. That's the beauty of the mind-body. It's so intertwined. It's like, wow.
Right. So you've written about galectin-3 playing a role in Alzheimer's disease and playing a role in the formation of amyloid plaque.
Right. A lot. Because in the amyloid plaque, in the Alzheimer plaque, the galectin-3 concentration is 20-fold compared to the normal central nervous system tissue. And the microglia, the astrocytes, are driven to become inflammatory through galectin-3. So the microglia are very similar to the macrophage in the body. They clean up the mess, and they need to be there. But when they're going out of control, just like in the body, then it affects it. Right. So I discuss all of this in the book, and I really want to emphasize, I mean, people will see this later on, but people are seeing it today. During this 1 week of September 21 to 28, starting today, the ebook, the Kindle, is available for only 99 cents. My publisher is making it available, really, because my goal is just for people to just really, I'm really sharing my heart in this book. So I put the time, I put the effort. I really want as many people to really read it.
Have you talked to Dale Bredesen or some of the doctors in his group about incorporating this into their protocol for reversing Alzheimer's?
No, I was in touch. I was in touch with the Bach Institute a few years ago, but the guy who wanted to start the research left it. And but yes, of course, there is. It's. Now we realize that Alzheimer is a vascular metabolic disease. It really is. I mean, I think about a dear relative of mine who had Alzheimer, and she was getting better she was taking a lot of vitamins. She was getting better, but a family member of her got so upset at her, he made her stop, and she really deteriorated.
Yeah. Dale Bredesen now, for the first time, is published a study showing reversal of Alzheimer's in 25 patients. And now they're getting ready to do a study.
Absolutely. Alzheimer is a reversible disease. Absolutely. Yeah. I mean, it's not easy.
But only with the functional medicine approach. Because the conventional medical approach really has nothing to offer at this point in time.
Yeah, right. Definitely. Yeah.
Perhaps you can tell us a story about how you developed this modified citrus pectin.
Yeah, so, I'm a native of Israel, and I'm 62 years old. It was 1971, and I was 12 years old, and we took a walk to our neighbors, Ruth and Leo Cohen, both of them PhDs in organic chemistry, were the pioneers in the citrus industry in Israel. Israel in the early 20th century, all the way to late, was pretty much most of the open land was citrus orchards. So they were experts. And then Ruth, out of the blue, she turned to me and she says, Isaac, one day they will find a cure for cancer from the citrus fruit. And it stuck in my mind. And 24 years later, when the first study on MCP came out with Avram Raz, I called her, I told her, Ruth, it's Isaac. I called her from San Francisco. My mother got her number. So, you probably don't remember. I remember what you told me when you were 12 years old. And she put me in touch with the key pectin researchers in Europe. and they helped me to develop modified citrus pectin. And since then, I can say comfortably that modified citrus pectin, Pectasol, have added tens of thousands, if not hundreds of thousands of years of life to people. So it's such a privilege to have the opportunity to make such a contribution. And really, Ruth is the one who spiked this in my mind. But then it's important. If I was caught in a box that it's only cancer, I wouldn't see the other indications, that sometimes I get emails from researchers, hey, you got to check these. I tell them, well, guess what? We already published or we already discovered. So it's a very growing field, but we don't want to get lost in the details. In medicine, it's easy to get lost in the details because we know so many details. It's important to remember the big picture. The big picture is that survival paradox shortens our life. You want to know what is a proven anti-aging treatment? Blocking galectin-3 using modified citrus pectin. Because galectin-3 drives aging, drives chronic disease. There is no argument about it. And so you really understand how when we train the survival paradox, our longevity improves not only from a point of view of the length of time, but from the quality of our life.
So galectin-3 should be part of a longevity program.
Blocking galectin-3 absolutely the first supplement you take because it works synergistically with so many others.
Do we know if modified citrus pectin affects Ampk or any
Of course, absolutely, definitely it does. Of course, because galectin-3 blocks insulin receptor, shuts down Ampk, and mTOR1 goes up. So that's why. But
similar to the way metformin.
Of course, but metformin works intracellularly. So, for example. So it's a great combination, but from a natural product, I use MCP with honokiol because honokiols will block will enhance AMPK and block mTOR1 and block AKT and block HIF. I don't have a diagram here, and I think in the book I took it out it's my favorite diagram, but I didn't want to make the book too medical. These are all factors that will block PDH, pyruvate dehydrogenase, and will shut down normal metabolism in the mitochondria. So honokiol with MCP, and we have demonstrated enhanced synergistic anti-inflammatory, antioxidant effect. We have multiple patents on this. We published a number of papers on this, and at some point we'll develop a neuroinflammation product based on this combination.
Oh yeah, definitely. You should be testing that on rats or dogs.
We are. We've already published a number of papers on this. Definitely.
What about using MCP with berberine, which is
of course. So berberine is very similar. I prefer honokiol because it has a more wider range of benefit. It also changes glutamate into GABA. So it reduces the excitatory effect, so it's very relaxing. It has more of a neuroinflammatory effect. It's synergistic with practically every cancer treatment because of the same mechanism. So we use them together. MCP honokiol is a great combination for all for glioblastomas, for example, for brain cancers. Yeah, definitely.
Interesting. And what would the dosage of MCP be? Would that be 15 or 20?
Yeah, no, it will be 15. If galectin-3 is high, you can go up to 20. And then honokiol, you can go up to 1 gram 3 times a day. The main side effect is diarrhea sometimes, so you stop and it goes away.
And for galectin-3, what should be the target? What's considered low? What's considered high? What's optimal? So if I wanted to be on an optimal longevity program.
So ideally, optimal will be 8 to 10, 8 to 11. It's lower now because the Abbott platform, which is what is used, gives lower numbers. So again, it's another problem. But it's definitely, if you look at normal labs based on the BGM manual kit, they will say under 17.8 is normal, sometimes under 22. If you look at the Birmingham offspring study, 8,000 people with microalbuminuria, they already have a problem, the average is 10.9. The 20%, the 40 lower quintiles, there was like 9 or 10, compared to the highest one, which was 15.6 only, 3 times all-cause mortality in 12 years. 3 times.
Wow.
And it's 15.6. So somebody will think it's normal. So basically, when it comes to modified citrus pectin, you should take it based on your condition. Now, if you're totally healthy, like you don't have inflammatory condition, not a problem, and your galectin-3 is low, it's 10, 11, then you can take 5 grams a day. If you're over 40, go up to 10. If your galectin-3 goes to above 14, you need a full dose already. Why? Because there's more galectin-3 to handle. It's not use or not use. It's just more galectin-3, so you need more MCP to actually block it.
Is there any benefits to recovering from a long-term viral infection?
Oh yeah, because you want to get the post-infectious fibrotic effect, of course. Same with viral, same with radiation, same with surgery, same principle, of course. You want the healing
with like long-term symptoms after viral infection. This could be an important part of the protocol.
Very, very important. It's like I write about it in the book. There's this Buddhist concept of writing in water or birds flying in the sky, and then it disappears. That's how you want your healing, with no scarring, with no remnants. And what causes the remnant, what causes the scarring is galectin-3. It drives the scarring process.
So as a chiropractor, I treat many musculoskeletal conditions like herniated discs and tendinitis. I'm assuming that galectin-3 is probably playing a role in those conditions and modified citrus pectin.
Absolutely. And you will see effect. The other supplement that is amazing for this chronic inflammation, and especially for dental health, almost a miracle, is PEDMA Basic. Anybody with gingivitis, with root canals problem, with periodontitis, PEDMA Basic 3 twice a day.
What is it?
PEDMA Basic. PEDMA Basic is a Tibetan-based herbal formula.
Oh, okay.
It's really not concentrated. It's the herbs themselves, but it's an approved drug in Europe since 1965 for circulatory problems.
Oh, okay.
So it's very important during COVID times because it reduces inflammation. But the real amazing things is dental problems. It's insane. Nothing like it for dental problems. And of course, Honokiol and modified citrus pectin are very important for dental problems. There's much higher level of galectin-3 in the plaque, in periodontitis. And so these are all important.
Interesting.
Factors.
Some of the longevity researchers are looking at periodontitis as sort of a marker of aging.
Of course. I mean, I send every patient of mine gets an eye kit, a cone beam, to look at pockets of inflammation. It's a much bigger problem than mercury in the teeth. Yeah, definitely. And it will reduce it. PEDMA Basic, I mean, all these 3 compounds, PEDMA Basic, modified citrus pectin, and Honokiol, but PEDMA Basic is like insane. It, of course, will improve your circulation, open out. It's all that. It has meta-analysis clinical trial, like drugs don't have it. But for the dental, I've just realized because of multiple patients recently, my God, the community needs to know this. We have something. They published a study on chronic pulpitis, which is really infection of the root of the tooth when you need root canal. And 80% didn't need root canals. And pains went down in days. I'm seeing this clinically in patients.
Really?
Yeah, and only 3 twice a day.
Wow.
Amazing supplement. Really a gift from nature, a gift from the Himalayas.
Cool. I'm going to have to look into that. That's something I'm not
aware. I'll send me an email. I'll send you the study. It's
okay.
Very cool. Yeah. Great. And it regulates immune response with the cytokine storm.
Oh, yeah. Cool. Awesome. Cool. Okay. Thank you, Isaac.
Thank you. And and everybody, the book is available on Amazon.com, or you can go to survivalparadox.com. We have a really nice landing page with the information. And again, we're making it so affordable, the book, because it really has a unique message. I think it's time to take our approach to medicine to a different vibrational level, to a different awareness level. Yeah.
Yeah, it's about time we start focusing on health and not just disease.
Yeah, and beyond inflammation. What's beyond inflammation?
Right.
Thank you. I love talking to you. I'm looking forward for the next time.
Absolutely.
Take care.
Thank you so much.
Bye, Ben.
Thank you for making it all the way through this episode of the Rational Wellness Podcast. And if you enjoyed this podcast, please go to Apple Podcasts and give us a 5-star ratings and review. That way, more people will be able to find this Rational Wellness Podcast when they're searching for health podcasts. And I wanted to let everybody know that I do now have a few openings for new nutritional consultations for patients at my Santa Monica Weitz Sports Chiropractic and Nutrition Clinic. So if you're interested, please call my office, 310-395-3111, and sign up for one of the few remaining slots for a comprehensive nutritional consultation with Dr. Ben Weitz. Thank you, and see you next week.